that?
I have a problem with the leg.
Okay, Kaden, triage these guys. You guys, get in here.
I got more time. I need nitro and help over here.
The EMT program here at ISU is a wonderful program. The students have a lot of opportunity to learn patient assessment, learn how to take care of a patient, whether they're medically ill or have a trauma situation, or both, because lots of times medical will lead into trauma. We are at the mass casualty situation for the EMT class. It's just a great time that everybody has to experience a mass casualty and to learn the do's and don'ts through actually having moulaged patients and real acting patients.
Are you gonna be okay? Is he gonna die?
It's adrenaline pumping for sure. It's definitely been fun though, and I've enjoyed it so far.
I was actually a victim last year, and so I kind of knew it was coming, but it's a lot different being on the other side of the fence, if you will, being the EMT instead of the patient, and it adds to the stress, and it's a lot of fun.
It's very tough because part of you really wants to be able to help every patient, but to be able to calm yourself down, handle those who are in desperate need, get them taken care of and do it. It's been exciting because we don't get a whole lot of situations like this, so having a lot of people where we don't know the situation, we don't know what we're going into, and being able to do all these things has been super fun.
I think it was a little hectic. I think that we're all still learning, but I think that it's given us so much training and something that we could potentially do one day, so it's nice that it won't be the first time when it's a real time, you know.
People learn to be EMTs, whether you're actually an EMT or just use it in your regular life. You learn more than just basic first aid. You actually learn how we can save a life and what's involved.
I always wanted to be able to help people, and I've definitely learned to be able to see a person, know if they're sick or not, and be able to do my interventions and know generally what to do.
In the hospitals, it's a completely different thing, but while you're out there, you actually get to assess the patient when they first start having their symptoms. It's just exciting trying to figure out what's going on with them, like why are we acting like this, you know?
I've learned quite a lot. We've done some OBGYN stuff, some baby births. Today we're doing mass casualty day. I feel like I've learned quite a lot on that, how to apply tourniquets, the ABCs, which is airway, breathing, circulation. So basically just how to treat your patient the best you can is what I've basically been learning.
Honestly, I've learned a lot. I've learned especially teamwork, working under stressful situations.
I've learned how to ultimately take care and treat for, immediate life threats and be able to be a first responder and take care of patients.
One of the things I've gotten out of this program is more of a refresher. I've been on the Bannock County Ambulance as a volunteer for about 3 years. This is a great refresher to things that we do on a regular basis, but to go back to the basics and to remember there's some things that we can forget sometimes, and just to continue to expand skills and things like that.
My favorite part personally is getting the hands-on. It's really exciting to be able to put the things that you've learned into practice.
I would actually say that trauma assessments are my favorite. It's nice to make some people's day a little bit better. It's nice to help people the best you can. Also, I honestly think it's the coolest when you get to apply bandages, and I'm a little bit weird with that stuff. I like the cadaver lab and stuff. It was kind of cool to see some certain injuries.
My favorite part has been how everybody connects and how the teachers really encourage everybody to work together and how much of a team building activity it is.
Everybody in here is like family. I love everybody in here, and my heart has been in EMS for a while, so it's fun learning everything.
Probably my favorite part has been the class. A lot of the people here have been really wonderful, really fun, and everyone comes from totally different backgrounds. So it's been really enjoyable because we've all gotten along really well and created some lifelong friends, and along the way I've learned a lot from each other.
Get to know your teammates, especially. I've heard that other classes don't really get along with each other, and I don't understand because our class loves everyone. We are always eating in that class, we're always DoorDashing, we're always getting pizza. Just get close with your classmates. It's so much funner if you do.
What I'd tell students who are thinking about coming into this course is, if possible, I would definitely try to get some experience before you get here. Realize if you like to be on the ambulance, or if you'd like to go into whatever field that direction you're going into, if you can volunteer in your own communities before you get here, it'll help you a lot to realize that, make sure this is what's right for you, because it's not for everybody. And volunteering is always great, and there are places in our communities that need the volunteers.
I would tell you that it's going to be very confusing and you're not going to know what you're doing until midterms. Once you hit midterms, everything clicks and it makes so much more sense. So don't be scared if you're not doing well the first few weeks.
We tell the students, wait until after midterms before you judge yourself, because right now we're just putting all the pieces together. It's like a puzzle, and you have a piece here and a piece there, and then after midterms, all of a sudden the pieces start fitting. And it's so cool to see that light come on when those pieces start fitting into each other and the light comes on. I've got this now. It's just fun to take people from knowing hardly anything to being able to totally treat and take care of people.
The thing that I would say is don't be shy and don't be timid. Get in there, get your hands on, be willing to make mistakes. We're all here to learn. We've never done this before. You're only gonna get better by practicing it, and for sure you're gonna learn from your mistakes. So don't be afraid to just get in there and get after it.